Hi, everybody. Welcome to the bi-monthly report of the COVINFORM project. Together with Marina, Zannella, myself, and Ambrosetti, we'll interview today one of our partners of the project, that is Rafalowski from MDA, and Marina will tell you more about that.
Thank you, Elena. So today we are going to interview Chaim Rafalowski, who is the Disaster Management and European Union Project Coordinator at NDA in Israel, as well as member of the COVINFORM European Project. We will discuss together the experiences, findings, and successes of the vaccination program in Israel that is well known to be a leader globally for its vaccination efforts. So thank you.
Thank you, Chaim. Let's start with the presentation of the campaign in Israel. So the main figures and how you have organized the campaign on the field. Thank you.
Okay, so let's start with the figures. Israel started the vaccinating mid December last year, and Israel is vaccinating people who live in Israel with only with Pfizer vaccine, which means 2 doses and 21 days apart between one dose and the other. And it is important to say that from the very beginning, the national health policy is that we will assure that people have the second dose, which means that at any given moment, there is an amount of vials which is kept to be sure that the people will have the second dose, even when it meant in the past that we are decreasing the number of people that get the first dose. And I'm pointing this out because not everywhere this is the philosophy. For example, the UK authorities decided that it is more important to have a large number of people with vaccinated whatsoever, even if it gives only 50% of immunity, than having a smaller group with 95% of protection, which is what the second dose gives you. At this moment, Israel has vaccinated 5.1 million people out of 6 million which are eligible. And out of those 5.1 million, we have 4 million people that have already received the second dose plus 7 days, which means that they are protected. And for the last 2 weeks, we are also vaccinating people who have recovered from coronavirus disease and have passed 3 months from the day that they were declared as a recovered person. That group of population will be receiving only 1 dose of the vaccine. Just to clarify one thing, the total population in Israel is 9.3 million inhabitants. Mm-hmm. And out of the 9.3 million inhabitants, we have 6 million that are eligible to be vaccinated, because they are over 16 years old, plus around 700,000 people that are recovering from coronavirus. That leaves us with roughly 2.5 million kids or young people younger than 16 that at the moment cannot be vaccinated. And this is an important figure because that means that Israel will not achieve herd immunity before we start vaccinating people younger than 16 years old. The famous herd immunity means 75% of our population vaccinated. 75% out of 9.3 million people is the figure of 6.75. Let's say the 75 is covered by the recovered, but that means that we will have to vaccinate 6 million out of 6 million people that can be vaccinated. We are at the moment with this group of 1 million people that are not being vaccinated, and this is the figure which represents the vaccination hesitancy in Israel, which means that this is the hardcore group that it requires a lot of effort to vaccinate them. Most in Israel, the people who wanted to get the vaccine already have it. So now we are fighting on those who don't want to get the vaccine. We started vaccinating people who are 60 years old and older, frontline healthcare providers, and people resident in long-term care facilities, either for elderly people or for people with disability. That was the first priority. Then into the priority jumped a group that at the beginning we did not think we are going to vaccinate, and it is pregnant women. We started with a recommendation that there is not enough scientific evidence for the safety of the vaccine on pregnant women. Not because the vaccine is not safe, it's important to say that, it's just that the group that participated in the Pfizer test, the third phase of the Pfizer test, that were pregnant while they received the vaccine was too small. And because it was too small, it was not statistically significant. And that's the recommendation, was that they are not going to be vaccinated. But, and this is the big but, when we started understanding that what we are seeing are the results of the British variant. And at the moment, more than 80% of the cases in Israel are associated with the British variant. We started seeing a lot of pregnant women that are seriously sick. We were at the top of the pandemic with more than 40 pregnant women and women post-labor that were hospitalized in critical condition. Just to give you an idea, as of today, and today is a good day, we have 46 women that are hospitalized, pregnant and post-labor. Out of them, 3 are mechanically ventilated, 1 is on ECMO, and we just had recently very sad cases of newborns that were delivered dead and tested positive to COVID, and pregnant women who died because of COVID. And we need to remember, this is a group which was not considered a vulnerable group. They are young, healthy women, and still they became very sick. So our gynecologist changed their recommendation together with the experts in immunization. And the clear guidance in Israel at the moment is that women 2nd and 3rd trimester must be vaccinated. And even women in the 1st trimester, which we know is more sensitive, if they are in direct contact with large groups of population, especially those who are not vaccinated, for example, children, should be vaccinated because of the risk to their health and the risk to the pregnancy. So this jumped into the really top of the list of priorities, and unfortunately, these sad stories motivate women to get the vaccine. So this is what we are seeing. That was the next group. And then we had another group which is interesting, and these are the 16 to 18 years old teenagers. They were out of schools for a year. And in Israel, we still have these exams to graduate high school. And those exams determine if you will ever enter university or not. And it was clear that if we don't bring that group of 16 to 18 to face-to-face classes, they will fail their final exams. And we will have a generation that never entered the university because they were the Corona generation, which is something we did not want. And of course, Pfizer is allowing to vaccinate teenagers older than 16, so they came into the group. And then, of course, we started going down with the age groups, and now for the last month, Israel is vaccinating whoever wants to be vaccinated in Israel. So this is just an overview of the age and groups that we use. A few words about the system. And the system, first I have to say that one of our major reasons for success is the fact that in Israel, the operation is run directly by the Ministry of Health. The Ministry of Health went out of their normal role as the regulator, which is in Israel, the Ministry of Health is not a healthcare services provider. it is a regulator in the government where the direct actors, the direct providers are others. Here, the ministry took the role of one national operator for the vaccination operation, and they manage it directly. They buy all the supplies, the vaccines, of course. They receive that. There is a special unit in the Ministry of Health that receives the daily plan for vaccination for the next 3 days. They approve it and they distribute the vaccines using a company, but it doesn't matter. And they are monitoring on an hourly basis how many vaccines have been distributed in each and every place, and they adjust the plan for the next day accordingly. So you're asking about what happens when there are leftovers. It's mainly that for the next day you will have less vaccines, because they will tell you, okay, you have leftovers from yesterday, and you should use them so they will not expire, because you need to remember that the Pfizer vaccine, the moment it goes out of the -70 to the normal refrigerator 2 to 8, it has only 120 hours that you can use it. So this is how they are really on very tight coordination and management of the operation. And here it is important to say that it's the whole healthcare system who is working on it, because people are asking me a lot about public sector. Public sector, it's one healthcare system working in the operation, and that is facilitated by a law. We have in Israel something which is called the Supreme Health Authority in emergencies, which basically brings under the Ministry of Health each and every healthcare provider in the country, regardless if I belong to a private entity, to a public entity, a municipal entity, or an NGO like Magen Adom, which is the Israeli Red Cross. Secondly, most of the vaccines, around 95% of the amount of doses, is provided by our health maintenance organizations, the HMOs. In Israel, we have a mandatory medical insurance law. And the law says one very basic thing. You must be affiliated to one of the 4 HMOs that exist under the law. You choose to which HMO you belong. That means that we have 4 entities that have access to 100% of the population. They have an electronic medical record, and they have the presence all over the country in smaller and larger communities. And most important, they are used to vaccinate, because every winter when we have our influenza campaign, our winter influenza campaign, they are the ones who will be vaccinating the population. So of course there are logistics challenges because it's Pfizer vaccine, etc., but it's not something which is new or a new system for the HMOs. What is different here is the role of the mobile vaccination, which is Magen Adom, which is the national ambulance provider, the EMS provider, and the Red Cross. We started vaccinating the long-term care facilities, understanding that you don't want to go to an elderly home with 200 people and bring them out to be vaccinated. And of course, they were the top priority because they are the most vulnerable when it comes to getting sick and dying during the COVID pandemic. So Magen Adom received the role of setting up mobile teams that will go to these long-term care facilities and vaccinate there. And already a month ago, we've finished the 2nd dose of vaccination there. So we can say all our most vulnerable population is already protected. That was the first phase. And then the government said, okay, guys, if you can do that, why don't you go to the remote communities? Israeli terms, but remote communities. Mm-hmm. Why don't you go to working places? Because we know that people are lazy. And often we heard, I'm not getting the vaccine. I want to get the vaccine, but I don't want to lose a working day. Or it's too much trouble to go to the vaccination site. So, okay, so we went there and we ended doing it in the marketplace in Jerusalem, in Tel Aviv, in the biggest square in Tel Aviv, in a spring festival in the south. And I'm sure you saw on the news in pubs in Tel Aviv. because one of the challenges is getting young people to get vaccinated. And young people like a lot the idea that they have a non-alcoholic free beer on one hand and the vaccine on the other hand, and they place it over Facebook, Instagram, or whatever kids are using nowadays, and it became a cool thing. So more young people would come to get the vaccine.
So do you think that this mobile team had really a key role in helping the rolling out of the vaccination campaigns?
It's, we need to outreach to people. And if I may, I will take it in a little bit broader aspect. I think that the greatest challenge that we have is the fact that my personal reading of the situation is that we estimated the hesitancy to get the vaccine for many different reasons. And the role of the group in some cases is extremely important. So even people that were, and there was a wonderful webinar of the WHO about vaccination hesitancy. And they made a very interesting point about the fact that most of the people are not in favor of the vaccine or anti the vaccine. Most of the people are in between in favor and in between against. And they have their doubts. And here, when the group is voting in favor, it helps them overcome their doubts. And the interesting thing is that in coronavirus, what we are seeing, at least in Israel, is that it is mainly an issue of trust. And it is trust in the authorities, how much I do trust my health authorities, how much I trust the information I receive. And amazingly, and I would say this is something that I think that in crisis management we will have to discuss a lot in the future, the position or the idea of my peers is as important, if not more important, than the position of the experts. It's like I'm watching an interview with a scientist talking about the vaccine, and at the same time, I'm chatting with my friends and listening to what they have to say about the vaccine, the things that expert is saying. And if my friends over Facebook or Instagram say it's bullshit, I treat the information as bullshit. Amazing. We thought that reliable scientific information has a role, and here we see it's the opinion of the friends. And so when we create this atmosphere of going to vaccinate in a working place, or when a family is out there doing whatever activity, and I see my friends, my family members getting the vaccine, it helps a lot to overcome the hesitancy. So I think that this is part, it's not the technical thing so much as it is the, I would say, the cultural thing or the atmosphere thing around vaccination.
Okay, that's very, very interesting. Thank you for giving us this perspective. I didn't imagine that there was so much hesitancy also in Israel because the campaign was quite fast compared to other countries in the world, so that we didn't think about that. And so how are you dealing nowadays with this? You mentioned at the beginning there is a number of population that they hesitant now that you have to convince. So how is going this process?
there are several ways, and it depends a lot on the population. For example, a lot of people are talking about the ultra-religious communities, the Muslim communities and the Jewish communities. And I have to say that here it is rather easy because those communities have a leader, a clear leader. And when you manage to outreach to the leader who says that it is important, that it is a good thing, the followers get the vaccine. So for example, we have an amazing video of the Mufti of Al-Aqsa Mosque, sorry, which is the third most important mosque in Islam, explaining that getting a vaccine is an act of faith for a Muslim believer, and not taking care of your health, and in this case, not getting the vaccine is not taking care of your health, is against the rules of the Islam. And this is something extremely important, and because it is Al-Aqsa Mosque, it was a Magen David Adom volunteer who got that interview and could record him, because a health authority in our political environment is way more complicated. But a volunteer from the community has that access. The same for the rabbis that issued the same statement. So this is one group. But you have other groups. For example, one amazing, one amazing thing we saw is that people from former Soviet Union. We have a large group of population in Israel that grew up in the Soviet Union and migrated to Israel. We call it came to Israel in the 90s. And they're hesitant. And when you ask them why, and they will tell you, because we grew up in the Soviet Union. And in the Soviet Union, if the state tells you to do something, you immediately become extremely suspicious. What is the catch behind that? What is wrong that they are making me do this? And they say, this is the way we grew up. When we came to Israel, we were in our 30s, in our 40s. So imagine, now they are 70, 80. These are the population that we want to vaccinate. And they tell you it's against our nature to believe the government. So this is another group. And here you need the older Russian doctors, which are well respected among them, to speak in Russian terms and explain. But that means that we need to target a very specific group here, which is the Russian doctors that will approach the community. For example, in other communities, teachers are, can you hear me? Yeah. Teachers are extremely well respected, especially those teachers who raised up generations from the same family. Mm-hmm. So it's the teachers that we have that we have to make the contact with. And in here, Magen David Adom has the great advantage of having volunteers that are part of each and every community in Israel, and can tell us who is the best to influence, who is the best to provide the information. We are engaging volunteers. We told our volunteers that their task is to have a family conversation around vaccination. So we are giving our volunteers all the information, the updated information, and we send them to discuss it with their family. And it looks like that the best influence on the grandfather and the grandmother is the granddaughter that comes and says, okay, I'm updated. This is new science. I know the new science. I will explain to you the new science. And by the way, new science is an interesting thing, because we heard, for example, that we have an issue with doctors and nurses, that when they studied, messenger RNA did not exist. I'm not talking about messenger RNA vaccination. I'm talking about the fact that something which is called messenger RNA in the cell does not exist. And imagine if you graduated in the 60s, it did not exist. And if you did not really follow up basic molecular biology, you are not aware that it exists. So of course they are hesitant, because it's something they don't know about, and sometimes they are embarrassed to ask younger people to explain them. And we understand that we have to respect them a lot, but provide them with the right information, because otherwise they are asked by their patients questions they don't have the answer to. And when they don't have the answer to, the easiest answer is, don't get the vaccine. It is a new technology, don't get the vaccine. And this is something that we want to avoid. The last thing is about respect and culture. And for example, we realize that one of the most important things, especially in Orthodox communities, again, Jews and Muslims, is to show respect. Show respect in many small things. For example, don't let the elderly wait. Respect to the elderly is one of the most basic code of conduct in those communities. Yeah. So you need to respect, you as the vaccinated organization, in this case, Magen Adom, you need to show respect to their elderly. So when an elderly person comes, you put that person in front of the line. You don't let the person wait. For example, for an Orthodox woman, showing her shoulder is considered
shameful.
Shameful. Yes, exactly. So you need to make sure that a woman will vaccinate her.
Yeah, sure.
Because for her showing her shoulder to another woman, it's okay.
Yeah.
To a man,
not. Yeah.
It is not okay. Small things, and what we hear from our volunteers is that women start calling one the other and say, come now, because they have a woman. There is a woman there. And these are the small things that are not about the macro thing, the chip that will be implanted, and things that really show the community respect, and they create trust. And as I said, at the end of the day, it's about trust.
Yeah. Thank you. So the role of the MDA and of the civil society, I would say, is key in this vaccination campaign. Exactly. I mean, of course, the Minister of Health had his role as well, but the role of the civil society in making not only the vaccination campaign possible, but also in giving trust to the vaccination campaign also.
Yes, and of course we are working very closely with the Ministry of Health, sharing our lessons learned and learning from others' lessons learned. Yeah. So we can really improve, because, as I said, again, it's about very small things, simple things, but they are essential at the end of the day.
Yeah, I have a question. This just out of curiosity. We can just not use this in the in the record if you think it is not an important question. I was wondering if you are vaccinating every day of the week.
Yes.
Okay.
Yes,
okay.
Of course.
Yeah.
Of course,
okay.
Of course.
No, this is also something important, because we are doing, for instance, the same also in Italy. But I was curious about that, because also it can be religious community, for instance, for Friday or Saturday that would not. But maybe those people can choose to not get vaccinated in this.
You adjust. I will not put a vaccination site on in an ultra-religious Jewish community on a Friday afternoon or a Saturday morning.
Sure.
But for example, a Saturday morning is a great day to vaccinate the Arab communities, because it's their day off when the Jews are not working. So this is their shopping and outdoors activities day. So we would use that day. It's adjusting. Just to give you an example, not about and we are going to do that again this year during Ramadan. We're not going to vaccinate during Ramadan during daytime. We did not test during daytime in Ramadan, and we're not going to vaccinate during daytime. And we will have there these crazy sites that will be working at until 2-3 a.m. in the morning after sunset, because people that finished their fasting, had the iftar dinner, and then they go to socialize. And when we are telling them is, okay, guys, when you go to socialize, come with your friends and get the vaccine.
Okay, brilliant. That's okay. And what are the future perspective of the vaccination campaign? I read that there is maybe a third.
It's beyond the vaccination campaign. First of all, we will have to finish the 1 million which is left. As we say in our region, inshallah. That's not going to be easy. And we need to prepare for the vaccination of people younger than 16. and we still don't know if and which age group will be vaccinated in the future. So that's the second thing which is there, and the third thing, which is, looking into the longer term, but we have to do it already, is about the idea that we will be vaccinating against COVID in the coming years, I would say even many years. And having a vaccine which is so sensitive, how are we going to do that? Because let's assume that they decide that, okay, newborns cannot be vaccinated, only children. And the moment I understand that the latest tests are being done, studies are being done on kids 5 years and older.
Okay.
So, okay, never mind, it's fine, it's okay. What's going to happen? We are going to have those sites that when you celebrate your 5th birthday, they will take you to get a vaccine. Is it going to be open every day, every month, every week? Only bigger cities, smaller cities? It's really going to become a long-term operation that we need to think about it now.
Sure.
The fourth thing is the most worrying one, is about the variants. At the moment, thank God, in Israel, we have only the British 80%, very small amount of the South African variant. And I think that we already saw some cases of the Brazilian and the New York variants, which are very, very similar. So at the moment, Pfizer vaccine is working. Yes, to a little bit lesser degree when it comes to the South African variant, but it is still working. The greatest challenge is what will happen if ever we have a variant which is resistant to the vaccine. So the pharmaceutical companies at the moment are working on having the new vaccine that will be able to deal with a new variant. I know that Moderna is already testing one, and Pfizer is already working on the technology to allow that to happen. So this is one challenge. The other challenge is that at the moment, we don't know, and we don't know because not enough time has passed, that for how long the vaccine provides you immunity against the coronavirus. So Israel has a very, very interesting project, the Ministry of Health. And by the way, I have to say that the National Director of the Public Health Services is a lady, Dr. Sharon Alroy-Price. And it's about a group of 1,850,000 people that received the second vaccine until January 31st, 2021. From mid-December to January 1st, 2031. And they are closely following that group to see what is the percentage of people that are confirmed positive among that group. I can tell you that at the moment, and it is a steady figure, it is being monitored once a week. We have that, in the week of February 2nd to March 15th, over a month, we had 0.13% of people that were tested positive. Among those 2,381 persons that were confirmed positive, 0.014% were hospitalized. And the good news is that only 0.01% out of the 263 hospitalized became critical patients, and 0.004% died. And they're monitoring this curve with the idea that if we see an increase in those ratios, it's not numbers, it's basically the ratios.
Yeah.
And they are doing genetic sequencing of all those positive cases to ensure that it's not a new variant. So we are crossing our fingers that never we will see an increase in those ratios, and together with it's the old variant, because if we see an increase in those ratios together with the old variant, it means that the vaccine is less effective, and we will have to start reconsidering a booster. Hopefully, we will not get there. Because if we get there, we have, again, 6-point-something million people to vaccinate. Let's redo the whole process.
You have to start over the campaign. Okay. Okay, but it's quite encouraging what you had till now. And then also I read the figures also in the UK. It seems quite positive feedback till now for the covering, at least for 1 year, we hope.
I hope for more, because I don't want to be in 1 year again in...
Wish.
Okay, excellent. So thank you very much. I don't know if Marina had other questions. Marina?
I mean, I had a few questions, but they have already been answered. But it was really extremely interesting to hear about all the things you told us about the vaccination, and especially at this hesitancy, the vaccination hesitancies, and how you are dealing with it. This was extremely interesting to hear. Thank you.
My pleasure.
Okay.
Thank you very much. Thank you very much.
With pleasure. Have a great day.
Okay.
You too. Goodbye. Thanks.
Bye-bye.
Thanks a lot.
Bye-bye.